Hello students, this is Dr. Praveen Tripathi, Faculty of Psychiatry at Cerebellum Academy and Conceptual Psychiatry. Perhaps you're watching this video because you want to get into psychiatry residency and you want to know more about it. And this video is going to do just that. It's going to be an exhaustive video. I have tried to divide this video into 3 parts. In the first part, I would be taking up all the queries regarding the training and the questions related to it. In the second part, I would be covering all the questions related to the psychiatric practice. And in the third part, I would be talking about some of the individual factors, some of the personal things that people ask when they want to get into psychiatry. So let's start with the education part first. So what is the residency in psychiatry like? Now, usually in comparison to say medicine or say surgery, psychiatry residency is considered as cooler. And by cool, we mean that the workload is comparatively lesser, right? But that is not always the case. Say if you're going to a place like Ehbas, Delhi, or if you go to NIMHANS, or say if you go to KGMC. So at these places, psychiatry residency is also pretty hectic. But in general, in comparison to medicine, surgery, or OBG, the psychiatry residency is considered to give you more breathing space. Super specializations, of course, we do have many super specializations. We have super specialization DM in child psychiatry. We have it in addiction psychiatry. Some places offer it in geriatric psychiatry also. So we do have super specializations available. But if you ask me that how many of these super specializations really help with the practice, I would say perhaps only child psychiatry. So if you're planning to get into academics, if you want to become a consultant, if you want to become a professor, then all the super specializations should help you. But if you want to get into private practice, if you want to open your own center, then perhaps child psychiatry is the only specialization that really adds some value. And I don't see these things changing at least in the next 10 years. Maybe 20 years from now, maybe addiction psychiatry or geriatric psychiatry would also pick up. But as of now, and in the near to midterm future, only child psychiatry is something that is going to offer you any advantage. We also have multiple fellowships. In fact, NIMHANS offers a lot of fellowships after your MD psychiatry. It offers fellowship in child psychiatry. It offers fellowship in neuropsychiatry. It offers fellowship in OCD, in schizophrenia, in consultation liaison psychiatry. Many fellowships are there. And some other places like JIPMER also offer fellowship. There are many others also. So you can go for these. These are short 1-year fellowships, and at least fellowships like child psychiatry would definitely help you. Some students ask that, can we go for DM neuro after MD psychiatry? To the best of my knowledge, the answer is no. There is one place, if you search for it, which says it offers DM neuro after MD psychiatry. But even that place asks for 6 months of medicine posting in MD psychiatry, and no program in India offers those 6 months of medicine posting. More importantly, and this is the personal question also, because during my second year of residency, I was also very interested in doing DM neuro after MD psychiatry. But now, as somebody who has been in practice for many years, I realize that if you want to become a neurologist, become a neurologist. If you want to get into psychiatry, get into psychiatry. This middle path does not really help, right? So there is no real advantage of doing DM neurology after psychiatry. If you think I would see neurology patients also, psychiatry patient also, doesn't really work. This is not how patients approach a doctor, right? So I would advise you that and there is no reason to do DM neurology after MD psychiatry, right? We'll talk about the practice part later on. Research opportunities are almost non-existent in our country. NIMHANS offers some research opportunities. Apart from that, I don't think any other place really offers you any research opportunities. If you're interested in research, probably going outside India would be a better approach. Need for senior residency. Now, psychiatry residency of 3 years is usually sufficient in most of the cases. If you want if you again want to get into, if you want to get into academics, then of course you have to complete the 3 year of senior residency. But if you plan to get into practice, private practice, I think 6 months to 1 year is what you need. In that amount of time, you become more fluent in seeing the patients, you become more confident in seeing the patients. And if you want to learn ECT or RTMS, that you would learn. I also did senior residency for 6 months only, and after that I jumped into private practice. This is also important Because see, if you want to get into private practice finally, the earlier you start, the better it is going to be. Because there's some period, there's some lag period before the practice gets established. So when you're young, when you are in your late 20s or early 30s, when you are energetic, you should be spending that energy in building up your practice rather than working in a hospital or working for some corporate. So this is one good thing that you can start your academic your professional life pretty early. But if you want to get into academic institutions, then of course you have to complete the 3 year of senior residency. How important is language issue? If you are from a North Indian state and if you are getting a residency in a southern state, or vice versa, if you're from South India and getting something in North India, should you consider it? I think you can consider it. I did my residency from Hivas, Delhi, and I had a junior who was from Tamil Nadu. He did not know a single word in Hindi in the beginning, but in 6 months he learned it. So whether you're going to South or whether you're coming from South to North, you can spend 5-6 months, you can get some hold on the language, and that should help you with the residency, right? So I think you can definitely do it. People sometimes say that you have to talk a lot in psychiatry, so language would be a big problem. It is not a big problem. It can be a problem, but you can learn the language. No big deal. So can I do residency from a private college or a college where the clinical exposure is less? See, if you want to go to a private college or where clinical exposure is less, that is okay. Because if you feel that after residency you're not well equipped to see the patient, rather than doing this senior residency for 1 year or 6 months, you can do it for 2 years or maybe even 3 years, right? So you can always pick up the clinical skills or learn the skills later on. As far as the content or the theory part is concerned, now we have all the apps for residency also. Those things you can learn from the apps also. Practical part, patient part, where you have to see the patient. For that, you can always do the SR shape, and this is what many people do. I mean, when I was doing my PG from ABAS, many people who went to colleges where the clinical exposure was lesser, they would come spend 1 or 2 years in SR shape, would become as fluent in seeing the patients, and then they would go up and set up their practices. So not a big deal. Patient exposure in PG sometimes is given too much of stress by the students. They are too worried that the patient load is less. But in medicine, you have to learn throughout your life. If you feel that the exposure was lesser in PG, you always have other opportunities like in SRship. Should you go to a medical college for your psychiatry residency, or should you come to a place like IBAS Delhi or CIP Ranchi or NIMHANS Bangalore? So both of them have their own advantages. Say a place like IBAS Delhi. So I did my PG from IBAS Delhi. Now it offers multiple things. There is psychiatry emergency. You get to see patients of catatonia. You get to see the patients of neuroleptic malignant syndrome. You get to see all the kind of EPS. You get to see patients who have high suicide risk. All these things you get to see. You have got psychiatry ICU. You have got open wards. You have got closed wards. You have got private wards. So the kind of exposure, the kind of cases that you manage, that is pretty nice, pretty good. Places like IBAS Delhi also give you a good exposure to patients who have depression or anxiety or other common mental illnesses, right? But that is about Delhi. Some of the places where the psychiatric centers, the exposure to the neurotic disorders may be slightly lesser. And if you go to a medical college, the vice versa may be true. You see more of common mental illnesses, less of all these complicated things. But I would say that at both the places you get to see both type of cases, and later on it doesn't really matter that much. For example, I am in private practice. In last 8-9 years I would have seen hardly 7-8 cases of catatonia, whereas when I was doing my PG we would see catatonia almost in every duty. NMS we hardly get to see in the private practice. There we used to see every few days. So it's okay whether you can go to a psychiatric hospital or a medical college, that is fine. Other factors like which one is closer and language thing and other variables may become more important. If you can get to IBAS Delhi, I usually say choose it. It really offers multiple things. But if not, then there are multiple hospitals. If we talk about Delhi, LH is good, RML hospital is good, Safdarjung is good. Similarly for other states. Can I go abroad after doing psychiatry? So yes, UK and Australia. It's pretty easy to migrate to UK and Australia. UK actually very easy. I think you just have to pass a language exam. Although UK doesn't pay you well. Australia I think pays more, but slightly tougher process. But in general, it's very easy to migrate, right? Many of my colleagues migrated to UK or Australia and they did not find it difficult. So how about DNB? So DNB psychiatry is also okay, right? You can do it. If you are not planning to get into an academic institution, probably DNB doesn't really offer any disadvantage. If you are planning to get into an academic institution, I think MD should be chosen over DNB. Even if you have to go to some periphery for MD, that should be chosen. But again, DNB, please ensure that you are going to a place where the pass rate is good. If the pass rate is not good, I would suggest that go for a peripheral college MD over DNB. Diploma, it's okay. You can, after diploma, you can go for your secondary DNB. And as far as the private practice is concerned, it doesn't really matter whether you do DNB or diploma or MD. Students sometimes think that patients look at your degree and then they come. That is not true in all the cases. In some cases, maybe. And you know, in medical practice, it's finally the word of mouth publicity. When you start seeing patient and they start getting better, then they start telling others about you, and that is how the practice grows. So private practice, if you are planning, I don't think you would have any major disadvantage. Maybe a little bit, but not so much. Academic institution, definitely MD over DNB. And if the pass rate is not good, then please don't go to that place. Learning opportunities may be definitely lesser, but then you can always do the SRship. But overall, I would always advise MD over DNB if that's possible. All right, let's now talk about the psychiatry practice. So, setting of the practice. Now, most of the psychiatrists work for themselves. They open their own small clinics and then the clinics keep getting bigger. So, majority of the psychiatrists work for themselves. Some psychiatrists with an entrepreneurial mindset may start their centers, inpatient centers. Some psychiatrists go into corporate hospitals and then small number stay in the government setups. So, for majority of the psychiatrists, own practice is what works the best. Now, sometimes people think that in psychiatry practice, it's all about counseling or psychotherapy. That is not true. Majority of the psychiatrists do the pharmacotherapy. There are very few psychiatrists who are very psychologically minded. They prefer giving therapy sessions themselves. So they go for psychotherapy. Otherwise, the majority of the psychiatry practice or practice of the majority of psychiatrists is psychopharmacology based. It's pretty similar to any other branch. A patient comes, you see the patient, you make the diagnosis, you write medications, you send the patient back, right? Most of the psychiatrists have clinical psychologists or psychologists in their team. The therapy part is usually taken care by them. Why don't more psychiatrists do psychotherapy? Because it requires a lot of time, and if you start giving sessions, the number of patients that you can see becomes very less. So practical considerations come in between. And that is why most of the psychiatrists end up doing the medical practice, thus pharmacology practice. Jobs is a problem in psychiatry. Most of the jobs are available in the de-addiction centers, especially in the Punjab region. If you go to a corporate hospital, you can get a job, but they would not pay you a fixed salary. Usually, most of the hospitals, what they do is they do the 70-30 thing. They will say that if you see a patient and if you charge 1,000 rupees, 700 rupees goes to you, 300 rupees goes to the hospital. So that is one thing. You can also get a job in a center created usually by another psychiatrist, a senior psychiatrist, right? So these are things. So many students get very discouraged that there are not many jobs. But my question is, why do you want to get into a job? Why do you want to work for other people? Right? The best thing about psychiatry is it's very easy to set up your own clinic. See, the problem is most of us come from middle class backgrounds, and we find this idea very unsettling that I'll have to set up my own thing, because we come from families where our parents are doing jobs, and for us doing your own thing is considered as risky, right? But I would say it's a great thing. It's a blessing in disguise. You see, job is a very addictive thing. Once you go and join somewhere and you start getting some money, you continue there. It's very difficult to let go of it. But if you start your own thing, that's so good. It usually takes 1 to 3 years for your practice to build up, depending upon how good you are at other things, how good you are at branding yourself or promoting yourself. But in this time period, almost everybody is able to set up their practice. So rather than running after jobs, do this. This is better. You are your own boss. You don't have to take permissions for vacations. Whenever you want, you can take the vacation. And see, it has its own charm. When you work for yourself, you work better, you work harder, you provide better services to your patients, and you do better for yourself also. Why do you want to give somebody this 30%? If you don't want to do it, this is also a good idea. I started with this. I joined a small hospital, and 1 year or 1.5 years, I built up my practice. When I had enough patients, I shifted to my clinic, right? And it's very easy to set up a clinic in psychiatry. All you need is a small place, a table, a chair for yourself, 2 chairs for the patient, 1 chair for a receptionist, and that's it. You can start the clinic that easily with like minimal investment. So I think this is one of the greatest thing about psychiatry practice. People don't really realize it because of our mindset. We feel that our work is dangerous. It's not. It's the best thing. Procedures in psychiatry are increasing. Now RTMS, transcranial magnetic stimulation, is becoming very popular. And ECT used to be there, but ECT has got a lot of stigma attached to it. So if you are doing your own practice, perhaps you would not be giving many patients ECTs. Although ECT is such a wonderful method of therapy, but because of the stigma, I don't do it. Nowadays, new things are coming up. Ketamine clinics are coming up, right? All these things you can do. People who want to make more money, who want to generate more revenue. So, when you do a procedure, it of course generates more revenue. So these things are coming up in psychiatry. I mean, they are not coming up. They have become quite mainstream now. If you want to make a lot of money, and if you are ready to take a lot of headache, open an inpatient center. Even in a place like Delhi, the number of inpatient psychiatric centers you can count on fingers. And if today I want to send a patient to, in fact, I was having this conversation with one of my juniors, that if today we want to send a patient to a private setup, which does not charge a lot, charges 3,000 rupees per day. We don't really have many centers. Either we have government centers, or we have very expensive centers which are charging from 7,000 per day or 6,000 per day. Not every family can pay 2 lakh rupees per month, right? So there's a lot of gap here. And the same is true for other cities also. But running an inpatient psychiatric center needs you to work harder. You have to do rounds twice a day. You have to take care of sick patients. You have to ensure that nobody is, getting hurt. If the patient is aggressive, then you have to ensure that you are, on the top of the treatment. So all those things you need a team. But if you are somebody who wants to work with that, who has that entrepreneurial mindset, that's a great opportunity. Inpatient center and de-addiction center, right? In India, it's yet to happen. I mean, look at the US. They have got such big chains, Betty Ford and whatnot. In India, all of these things are yet to be done. Somebody would do it. There is no dearth of patient. There is no lack of patient. And when you need an admission for psychiatric disorder, you need an admission. So there is still a lot of gap here. If somebody wants to really work in that direction, he would or she would do great. One of the good things with psychiatry is offers you a good work-life balance, right? I mean, once you are done with your residency, you don't really have to do the emergencies. You can come back to your home and sleep, and you can have a nice work-life balance. So that is definitely a good advantage. Money. So most of the students are interested in money only, and rightly so, right? Everybody works, everybody studies to finally make money. There's a lot of misconception about money in psychiatry. When I was a third year or second year PG, even I was very demotivated, because my seniors used to tell me, who were doing SRship or who were APs, that there is no money in psychiatry. They used to tell me that there are no jobs, and it's going to be very difficult, and you would not be even able to make 80,000 rupees a month or 90,000 rupees per month. And I used to feel very bad about it. Then what I did, I talked to some of my seniors who were in the private sector. I still remember the name of this senior of mine, who was my senior from UCMS also and ABAS also. His name is Dr. Siddharth Chilani. He used to practice in South Delhi, and I would talk to him, and he would encourage me a lot. He was into private practice, and he used to say that I am doing so good. It's been only 1 year or 2 years, and he was doing pretty good. And he used to tell me the numbers, and the numbers were good. And he used to say that I am doing so good, and he would tell me that you are also pretty good and you would do great. So what perspective you get depends upon the person whom you talk to. If you're talking to a person who is an assistant professor in a medical college, he does not really know about the scenario outside. The life in that medical college is very different from the life outside. So sometimes they are the people who did not go outside, who did not try private practice, or who were too scared to do private practice, or who themselves were dissuaded by somebody else. So they have a very pessimistic view. As far as PGs and SRs are concerned, they have no idea about what is happening in the outside world. So like Dr. Chilani, I also got into touch with one of the senior doctors, Dr. Sanjay Chugh. He's a very famous doctor in Delhi. And I talked to him and he was like, "Yeah, koi problem hi nahi hai. There is no problem. Start practicing and you will see a lot of patients." And the reason why I'm telling you this is I have gone through that phase where I was demotivated by multiple people. All of them were in the government setups. But when I used to talk to people who are in the private setup and the successful ones, they used to encourage me. And as a person who has been working in the private sector for quite some time, I would tell you that money is never a problem in psychiatry. Simple reason. Say your fees is 1500 rupees or say it is 1000 rupees in the bigger cities, right? And you see, say, how many? So you want to make, say, 3 lakh rupees per month, right? For that, you have to see just 10 patients. If your fees is 1000, only 6 patients if your fees is 1500 rupees. Do you think that you would not be able to get 6 or 10 patients? It doesn't work like that, right? There is no dearth of patient and there is no problem of money. People have this misconception and some of you might be thinking that probably you were able to do well. That's not the case. A couple of days back, I was just talking to one of my juniors who is practicing in Kurukshetra. And he has been practicing for like 5-6 years now, 4-5 years now. And he was telling me that he sees 50 patients a day. His fees is 300 rupees, and he sees 50 patients a day. Now you do the mathematics. One of my juniors who is working in Bhopal, more than that, right? Lesser number of patients, but even higher fees. So why am I telling you names of these smaller cities? Because it's not only in Delhi or Mumbai or Bangalore that people are doing well. People are doing well in the smaller places also. So this idea that a lot of people carry that it would be very difficult to practice in psychiatry is completely nonsensical. As a rule, if you can practice for 3 years, you would definitely be making around 3 to 5 lakh rupees per month minimal, right? And if you are entrepreneurial, if you want to have your own chemist shop, if you want to do all these procedures, if you want to get into inpatient setup, then sky is the limit, like it is true in all the branches. So do not get dissuaded unnecessarily and do not talk to people who are in the government setup, with all due respect to them. If you really want to know about any branch for that matter, not only psychiatry, go and talk to somebody who is working in the private setup and has 3 to 5 years of experience, preferably somebody who is running his or her own center. Some of them would not want to divulge you the information. Some people are still in that mindset that competition should not increase and let us not tell people how they are doing. But most of the doctors are nice enough and they are secure enough, right? Today I'm not really insecure that a new psychiatrist would come and would take away my practice. That's not going to happen, right? So most of the people who are secure would tell you the real scenario, and the real scenario is pretty good in all the branches. In South, I think there's a problem, especially in Tamil Nadu and probably Kerala, where there's the number of doctors are too many. But at least in the northern part of the country, the western part of the country, and the central part of the country, still the ratio is pretty okay. I'm not really sure about what's happening in the Tamil Nadu and Kerala. Somebody from Tamil Nadu or Kerala would be better able to answer it. But for the majority of the country, things as of today are pretty good. I don't see them worsening significantly in the next 5 or 10 years. All right. Big cities versus smaller cities. Again, so what happens in bigger cities is you can charge more, but the number of patients that you see is usually lesser. At the peak of my practice, I used to see like 43 patients. That is the maximum that I've seen. On an average, I was seeing 30 patients. But then I got into academic cerebellum and all, and then I decreased my practice significantly. Smaller cities, you tend to see more number of patients, but you tend to charge lesser consultation fee. And that is why I again say that, don't stay in corporate hospitals for too long a time. When you start your own center, you charge less fees, patient gets benefited, and you make more money. Both things are true. Violence in psychiatry. All right, so violence may happen in psychiatry like all other branches, but try remembering the last time you heard a case of violence in psychiatry ward. Violence more commonly happens in the medicine emergency or surgery emergency where the emotions are running high. In psychiatry, the thing is everybody knows that if a patient is aggressive, you know that the patient is aggressive. You would ensure that the patient has been properly medicated or the staff is there, security is there. Since you take more precautions and since as a psychiatrist you are better trained to deal with the violent patients, the incidents of violence in psychiatry are rarely heard, right? It's the emergencies of the medicine, surgery, OBG, pediatrics where more violence happens. So violence in psychiatry can happen like in any other branch, but it's not really a big issue. You have to be cautious like in any other branches. You learn the skills how to deal with aggressive patients if there's an aggressive patient, and usually the setups are such that patients who are likely to be aggressive are already identified and you take your precautions. So violence in psychiatry is not a big issue. Sometimes girls come and say that what about violence? Not really a big issue. And if violence has to happen, it can happen in any branch. Legal issues in psychiatry are increasing like they're increasing in any other branch. Patient can sue you, right? So we have a Mental Health Care Act in India. You have to follow it, and you keep your documentation properly, you do practice ethically, you ensure that you are behaving with your patient normally. Legal issues usually do not come, but they can come to anyone. You should be prepared, and they can come in any branch. Likely impact of AI in psychiatry. All right, this question was asked by a few. I think psychiatry would also get impacted by AI like all other branches. Maybe it would get impacted later, right? I think maybe radiology or pathology would be the branches that may get impacted earlier. We do not know when that would happen or if that would happen. But in psychiatry, where you are talking, where human emotions are involved, where empathy is involved, I think it will take more time for AI to get into all of these things. And if it does come, then we'll see. I mean, if all the doctors are going out of the job, then so is the case. So is going to be the case with psychiatrists also. Individual factors. What kind of person you should be to become a good psychiatrist? I don't think it's a factor, right? People, sometimes students tell me that, sir, I'm very emotional or I'm very good at counseling and I would be a great psychiatrist. Whatever your temperament is, anyhow, you are going to learn in those 3 years of residency. The skills that you need to be a good psychiatrist, you will learn in those 3 years. What is your temperament? I don't think it's going to have a major impact. It may have a minor impact, but definitely not a major impact. Similarly, some people say that I'm very emotional and I get concerned with people very much. Again, that is not going to impact a lot. When you start seeing patients regularly, you develop that skill of talking to the patient without getting impacted too much. It is similar to medicine. When you do your first medicine emergency duty and if unfortunately some patient dies, you feel very bad. But later on, as you continue with your work, you are not really impacted by it. You do your work diligently, but you're not really impacted by it. Similar is the case. If you see a patient who has depressive symptoms or anxiety symptoms, you have to be very professional. But it's not that after seeing a patient who has depression, you become depressed. That really doesn't happen, and that cannot happen. If that was the case, how would anybody practice, right? So that is not an important issue at all. Stigma. So stigma about psychiatry and stigma about psychiatrists, both things, let's talk about it. So first of all, stigma about psychiatry. People say that patients would not come to you because there's so much stigma about psychiatry. That is true. But see, almost 10 to 12% of the population has one of the psychiatric illnesses. That's a huge number. And even if stigma stops 90% of them, 80% of them, still the number is pretty much high. So it's not that because of stigma, patient would not come to you. I have not seen a single psychiatrist who has worked for 3 to 5 years and who has a problem of having patients, right? That doesn't really happen. Stigma about psychiatrists, again, in the real world out there, things work in a funny way. I'll share some experiences with you. When I was doing my MD psychiatry from Airbus, Delhi, we used to feel that neurologists are at a higher level than the psychiatrists because they come from medicine and then they are doing DM. And that is true inside the four walls of those institutions. But once you get out of those institutions, when you have started working, the only thing that matters is, do patients want to consult you? If you are psychiatrist and outside your chamber 20 people are waiting, and if you have any other branch and there are not many people who are wanting to see you, immediately everything changes. I remember one of the neurology DMs who was not so nice to me during the residency period called me 3-4 years later. By that time, I had a fairly good practice. And he called me and he was like, hey, Praveen, tell me, how did you manage? How did you start your practice? How do you do this? How do you do that? Finally, in the real world, outside the medical colleges, your degree and the place from where you got that degree, all those things are not so important, but how you are doing becomes much more important. And, when you become successful, when people get to know about it, all the stigma goes out of the window. So don't get too worried about all these things. I mean, all of us have faced that. Sometimes in the beginning, we also had all of these, thoughts that how would people react and what would people say. And when things start going in your direction, nothing matters. Nothing really matters. So don't worry about the stigma. Once you become a good doctor, once you become a successful doctor, everybody would be, wanting a piece of your time. Why do we hear negative things about psychiatry? Again, a lot of people don't know about it. If you talk to people from your parents' generation, at that time psychiatry was not so good. All the patients were having some kind of psychotic illnesses, and we did not have treatment methods. And some of the treatment methods were very crude. If you're talking about 30-40 years back, so that some people carry that mindset. Some of the people who are working in the government hospitals, again, they carry that mindset that it's difficult to do practice because they never got out of the medical colleges to do practice. And again, if you go to somebody who's practicing, then you would find positive reviews or positive views. It all depends upon the person whom you're contacting. So if your PG who does not know anything about the real life practice is telling you something, you do not really have to care about it. Parents would never want you to become a psychiatrist because of the stigma and all. Even my mother did not want me to become a psychiatrist, but today she is very proud of me. This is what happens. People have a lot of notions, but once you get some success, people are fine. So if you want to become a psychiatrist, despite hearing some negative views, please go ahead. As I discussed, there are multiple good things about this branch. All right, can people who themselves have anxiety disorder or depressive disorder or psychotic disorders, can they pick up psychiatry? I would say yes. Why not? And would practicing psychiatry make their illnesses worse? There is no reason to believe that. Why would that happen? If anything, the residency should help them, right? There's no reason to believe. Talking to a person with anxiety, will it make me anxious? Will talking to a person who is having chest pain give me chest pain? It's like that only. In the first day or second day, you may get impacted. But after that, see, once you are doing the same thing again and again, you are more worried about completing your work and, completing your thesis and, reaching a time and punching out all those mundane things, then getting impacted. Doesn't really work that way. Don't worry about it. Do psychiatrists themselves develop psychiatric disorders? So there is no data regarding that, but it's a very commonly said thing. So we do not have any data to say that if somebody gets into psychiatry, he or she will develop psychiatric disorders. In fact, there is some hypothesis that if somebody has a mental health condition, they're more inclined towards psychiatry. So it's probably people who have mental illnesses, they're more likely to pick up psychiatry. That is probably true. But psychiatry leading to mental illnesses, we have no evidence. So these were some of the factors. I would, in the end, say that if you really want to get into psychiatry, irrespective of what anybody says, get into psychiatry. Whether you want to have a good work-life balance, whether you want to make money, whether you want to have a better understanding of yourself and the way things work, you will have everything in this branch. Like all other branches, there will be frustrations also, but that's okay. That's a part of medical life. If you're somebody who never likes psychiatry, do not get into psychiatry. That is also true. Psychiatry is slightly different because you have to talk more, and sometimes people feel it's not medical enough. In fact, I was one of the person who was very unhappy with psychiatry in my second year and a part of third year also, that it's not medical enough. Because at Ehbasna, there used to be a lot of therapy sessions, psychotherapy sessions. We had to take multiple psychotherapy sessions. There was a lot of discussion about psychosocial work and all of that non-medical part, and I never enjoyed that part at that time. And I used to feel that I am a doctor, I want to talk about receptors and all these things and tracks and everything, and I don't want to get into this psychosocial nonsense. But when you get into practice, you realize that you can practice psychiatry as biologically as you want. And now at this level, I also understand the significance of psychotherapy. Psychotherapy is very important. If you're getting into psychiatry residency, one suggestion would be always respect the psychologist who is there in your department and learn from that person. Just because you are a MD, just because you come from medical background, don't get all arrogant and say that I'm a MD and they have come after doing BA, MA. Don't do that. If you want to become a good psychiatrist, you need to be good in psychology as well and learn from psychologists. They play a very important role. It's a team that works properly. So this is about the psychiatrist residency. And finally, we have this app called Conceptual Psychiatry, and it is for psychiatry residents. And the thought process is that whether you go to a big college, whether you go to a small college, a private college, or a government college, a peripheral college, a central college, everybody should have access to good resources. And that is how all the conceptual apps are built. So you can get into Conceptual Psychiatry app. We have got multiple good teachers. Dr. Andrade, who retired from Imhans, is a part of it. There are people who have done their DMs in addiction psychiatry who are teaching addiction, fellowships in child psychiatry or teaching child psychiatry. I am also taking up some part. So there are multiple teachers there. You can see the app, and of course you get the notes, and we are adding MCQs and mock exams will be there. So the learning part you can definitely take care of with the help of the app. Now the app is there, so even if you feel that you are not being taught so well in the institute or college that you have joined, you can always come and study from us. So this is about the psychiatry as a branch, and I hope I was able to answer most of your questions. These were the questions that students were asking. And if you are coming to the psychiatry, welcome to the branch, and it would be fun. It would be challenging at times, but it would be fun. And if you really want to become a psychiatrist, irrespective of what anybody says, go for it. You would not regret it. All the best.